inflammation or toxicity or whatever the issue is. And those red blood cells get stuck, right? If we can't get red blood cells from this side of that capillary to the other side, we can't have gas exchange. What's the difference is once you have oxygen dissolved in the plasma, where red blood cells cannot go, plasma still can. And now all of a sudden you're getting oxygen flowing to the other side of that blockage or that damage or that inflammation, now feeding the hypoxic tissue on the other side and restarting that healing response. The third way brings us back to that seltzer conversation. We're basically pressurizing that gas into that liquid. And then when you get out of that chamber, as I was saying, those bubbles start coming out again. And that is exactly what happens inside of our bodies when we're exposed to that same environment. Why is that important? As soon as you're exposed to that extra oxygen and you get out of the chamber, do you ever realize that when you open the seltzer, the most intense bubbles come out right in the beginning? Yes? Or no? Yes? As time goes on, the power of that goes less and less because you lose the gradient. When you get out of that chamber and that oxygen starts to really pour out of your circulation, it's able to travel a further distance. In other words, there's a distance that oxygen can typically travel outside of the capillary to interact with a cell. When you leave a hyperbaric environment, depending on how much pressure you were exposed to, how much oxygen you were breathing, and how long you stayed in that chamber, the distance that oxygen is able to travel away from the capillary is somewhere between 2.5 to 4 times greater. Again, when there's damaged tissue and we're trying to hyperoxygenate, that doesn't happen while you're in the chamber. A lot of that happens as you get out and really start to nourish the tissue for the next 8 to 12 hours after the session. So we'll talk mechanisms of action. So the whole thing here is just, if you look at that graph, the 2 blue bars, so there's a hyperbaric treated group and a non-hyperbaric treated group. The 2 blue bars just indicate, regardless of whether you were treated or not, roughly 100% saturation is 100% saturation. That's never going to change. The difference is in the arterial gases, the actual gas that's dissolved in the plasma, and that's what that graph is trying to just show you. So again, I was saying that this whole system is regulated through pressure gradients. What we're going to just talk about today is that a normal resting cell and or a capillary, they typically live at a pressure of oxygen around 50 or 60 millimeters of mercury. Okay? So as long as the pressure of oxygen in your capillary is typically about 100 millimeters of mercury, and then as soon as it gets to the cell, which is resting at around 50 or 60, you have that gradient to allow the oxygen to leave circulation to go to that cell. You understand? That's the gradient differential that we were talking about earlier. So what happens in a hyperbaric environment? Well, again, if you're at normal air, 1 atmosphere pressure, just breathing air, the resting capillary pressure will meet the cellular pressure, which is around 50 millimeters of mercury. If we had, again, we're just at the surface, and I had 100% oxygen, we can go from 50 millimeters of mercury, we can increase that to about 75. So it's not like nothing happens with enriched oxygen at the surface. Something happens, but it's really not that critical. It doesn't make that big of a difference. When you go to 1.3, which is basically a soft chamber, at let's say 100% oxygen, instead of 50 millimeters of mercury, you're at almost 250 millimeters of mercury. It's an enormous difference in that gradient. All of a sudden, that driving force of getting oxygen out of your circulation into those cells and tissues goes up, 4 or 5 times. And if you go to 1.5 atmospheres, all of a sudden you're at 437 millimeters of mercury. It doesn't take a lot of pressure to make enormous changes cellularly for these patients. So we talk about this a lot when I lecture. These are what we call the pillars of chronic illness, but very quickly, we started at the top. At some point, there's hypoperfusion, whether that was trauma, toxicity, inflammation. Something is reducing the blood flow or the perfusion of oxygen to a certain cell or tissue. So from the decreased perfusion, we get a reduction in blood flow overall. We start to get an increase in inflammation. If we don't have good blood flow, we can't get rid of all the waste products of cellular respiration. So our cells start bathing in the inflammatory response. Then we start getting changes in metabolism. The mitochondria can no longer metabolize oxygen properly to make ATP that it's trying to make. We get immune system dysregulation, ultimately an increase in reactive oxygen species, which causes cell signaling disruption between neighboring cells, ultimately epigenetic changes in the epigenetic expression, genetic damage, cellular damage, and then ultimately tissue damage, causing more hypoperfusion. If we looked at that and contrasted the chronic illness pillars to the pillars of aging, they're also very similar. This loss of stem cells and changes to genetic and epigenetic expression, telomere attrition, mitochondrial dysfunction, increasing in inflammation. There's a lot of correlation between what we see as we age with what we see in chronic illness. And in fact, aging is the #1 risk factor of chronic illness. And chronic illness is really just an accelerated cellular aging pathway in many ways physiologically. The hormetic curve is just, you guys familiar with the hormetic curve? A little bit, some of you? So I like to talk about this just for a moment because this is what all of the interventions that we do need to land somewhere on this curve. All this is really describing is, on the lower end of that, I don't know if this works, does this work? No. On the lower end of that curve, there's not enough of a response to even get a stimulus from the system. In other words, if you don't exercise, and you're sitting in this chair, you'll never move your body enough to start changing cellularly and adapting to exercise. So you need to be above that initial line where it says hormesis. And the more adaptation, the more stress you cause the system, the more change you start to see, and the more adaptation you start to get cellularly, you start to improve the body's health and vitality. But you can also push that a little too far, and all of a sudden you start going over the top of that curve, and eventually you can get to a place where you've now caused too much stress to the system, that now the system can't even keep up. It's not healing as fast as you're breaking it down, and then we see degeneration over time. And hyperbaric is no exception to this concept. We're using oxygen. People say, well, doesn't hyperbaric oxygen increase your oxidative stress on your body? Yes, 100% of that. Is that bad for you? No. Sometimes. Depends how far you push it. It depends how fragile the patient is. Knowing how to use oxidation as a therapeutic tool is part of using oxidation on this hormetic curve. And so we have to utilize that tool in a way to make sure that we're nudging the patient in the right direction, causing enough stress to cause adaptation, but not so much to hurt the patient. These are the mechanisms of action. These are non-controversial. These are steeped in deep science. Even traditional hyperbarics using it for gangrene, osteonecrosis, radiation burns. Everybody agrees that these are the things that happen inside of a hyperbaric chamber. All right? The first one is a decreased bubble size. And all that really means is that's specific for like air gas embolism or decompression sickness, like the bends for divers. So those gases come out, right? So a diver's breathing air, which is a mixture of oxygen and nitrogen. And when nitrogen bubbles come up, we have huge problems. The bubbles I keep talking about when I say bubbles are oxygen bubbles. Oxygen bubbles will never bubble up and hurt you. They bubble up and they help you. Nitrogen bubbles can bubble up and hurt you, and that's what happens with diving accidents. And hyperbaric pushes that nitrogen back into solution so it doesn't hurt the diver, and then we bring them back up to the surface comfortably, allowing that to off-gas safely, okay? That's the only one that's really diving specific. The rest of these, hyperoxygenation, reducing lipid peroxidation, so we could reduce the breakdown, the oxidation of lipids. Do we have any important lipids in your body? Brain, myelin, cell membranes, nuclear membranes, mitochondrial membranes, right? So we can actually have a positive effect on lipid peroxidation, even though hyperbaric is an oxidative therapy, right? Which is, again, really why we have to understand this tool. It's not dangerous, it just needs to be applied properly. Vasoconstriction, again, for the decrease in swelling and edema. Reduced cytokine response. Toxin inhibition. Leukocyte oxidative killing. Your white blood cells use reactive oxygen species to kill infection. So you could increase your reactive oxygen species cellularly, which actually gives your white blood cells the ammunition that they need to fight infection in the first place. It works as an antibiotic synergy, so especially for antibiotic-resistant pathogens, and/or it helps to break down biofilms. So those anaerobes that love to live under those biofilms, the high oxygen environment helps to break those down. Angiogenesis, the rebuilding of that capillary network, which I was describing earlier. Neurogenesis, literally stimulating new nerve growth and synapse connections. Mitogenesis, again, increasing the number and size of your mitochondria. Fibroblast proliferation, collagen synthesis, boosting stem cells, and reverse transcriptase, which was figured out 2 years ago, where they saw that hyperbaric oxygen can actually increase your telomere length, which is part of the study that we're working on right now. I'll tell you about in a little bit. But if you understood the mechanisms of action, and you really, really understood them, became a master of mechanism of action with regard to hyperbarics, what you would see is literally every single step of the pillars of chronic illness or the pillars of aging are reversed using hyperbaric oxygen. Where you had reduced perfusion, you get increased perfusion. Where you had reduced blood flow, you get increased blood flow. Where you had increased inflammation, you have decreased inflammation. Where you had metabolic dysregulation, you have metabolic balance and regulation. Where you had increased reactive oxygen species, you start to just get balancing in that whole oxidative pathway. You normalize cell signals. You start to repair epigenetic expression. You start to repair DNA and telomeres. You start to repair cellular membranes. And all of a sudden you get cell repair and tissue repair. And so you could literally spin this entire, each step of the way, the entire cycle the other way. All right, perfect. Research. So these are just a few studies. I mean, like I said, the studies are growing by leaps and bounds, and these are just a few I pulled for the conversation we're having today. A single session of hyperbaric oxygen demonstrates acute and long-lasting neuroplasticity effects in humans, replicated randomized controlled clinical trial. They had 12 people in this study. They were really looking at central mediated pain. I will tell you, as somebody who's been using hyperbarics for about 15 years, I don't recommend doing a single hyperbaric session to really modulate central nervous system modulated pain, okay? However, they found that a single session actually had acute and long-lasting effects. I think they measured it 3 months out, and there was still an effect of the single session that they did. You know, typically the real benefits that we're looking for with regard to hyperbaric oxygen are a minimum of 10, but more typically 20 to 30 sessions, even 40 sessions in. I think this is a good one for the group here. This was done by a group out of Israel. What they did was they said, listen, they took 22 people, and they did a physical task, a motor task. They did a cognitive task, and then they dual tasked them. Okay? And then they did pre and post for everyone. So obviously, we had a certain score for the motor task and the cognitive task, and those were both higher than the dual tasking. We would expect that. However, every single participant had about a 25%, between 15 and 25% increase in each individual motor task or cognitive task. More importantly, what they found was that they had almost a doubling of their ability to dual task. So what question are they answering? They're answering the question of, just because you got more oxygen doesn't mean your body knows how to utilize it. In other words, I'm getting 100% oxygen right now. Why do I even need more? Just because I get more, will my body use it? And that's the question they were trying to answer, and the answer is yes. If you have more oxygen, you are now capable of doing more work. Think about this. Your body, even though you're 100% saturated right now, your body is constantly moving oxygen around to working tissue. Right? You guys were doing classes all day, brain was super stimulated, then you ate lunch. Right? So all the blood went from your brain to your belly. Because we don't have enough oxygen to do all things all the time. The body's if the fire alarm went off, we'd all jump and run out of here. All the blood would go to our legs so that we can get oxygen to the moving tissue. So the body's always redistributing the oxygen that we have to whatever tissue is working. And in this situation, they're saying, well, if I had more, could I do more? And of course, the answer was yes. Hyperbaric can improve post-concussive syndrome years after mild traumatic brain injury. So every participant, there were 56 participants. It was a prospective randomized crossover trial that they did. And they were measuring cognitive function, quality of life index, and then they were using SPECT scan as well. And they had to at least have a mild to moderate concussion, minimum 1 to 5 years post, to see if it had this long-lasting effect. They found significant increases in cognition, cognitive ability. They saw significant increases in quality of life index, and their SPECT scans matched the benefits that they saw both on the cognitive side and the quality of life side. So I brought this one up because it's an interesting concept that is important to talk about, especially if you're utilizing hyperbaric when you're talking to your patients about hyperbaric. So this was a study that they were looking at what's the impact of hyperbaric on stem cells. But they were measuring other molecules as well. HIF1 is something they were measuring. Familiar with HIF1? Hypoxic inducible factor. It's basically a molecule, it's a transcription factor that is typically signaled during hypoxia, low levels of oxygen. However, it's also signaled during hyperbaric because of what? When you go into the chamber, you become hyperoxic. When you get out of the chamber and all that oxygen is leaving you, you're not actually becoming hypoxic, it's just relative hypoxia compared to when you were in the chamber. Why that's important is it appears to signal all the benefits of hypoxia without any of the consequences of hypoxia. And so we get enormous hypoxic-like stimulation of stem cells and angiogenesis from this relative hypoxia scenario. What I want you to see here is that if you look at those, if you can't read them, the first two are, that's baseline and pre-hyperbaric, okay? Those are the levels of HIF1 that were measured. After 30 sessions, HIF1 goes up. After 60 sessions, HIF1 goes really high. And as soon as you pull hyperbaric, HIF1 drops off. We would expect that, okay? Compare that to the stem cell response. If you look at the stem cell response, that first one is pre-hyperbaric. That second one is 30 sessions in. After 30 sessions of hyperbaric, there's a minimal increase in stem cells. After 60 sessions of hyperbaric, they nearly triple. And a month after you pulled hyperbaric completely, it went 6 times higher. There is a delay between the cell signaling effect of hyperbaric and the ultimate benefits of hyperbaric. And one of the reasons that's important is because for years we'd have patients, we take breaks on purpose. We'll do 20 sessions, take three weeks off. We'll do 40 sessions, we'll take 3 to 6 weeks off. We do that purposefully and strategically because we know that they're not finished benefiting from the therapy until a little while after that break. But if you don't set the stage properly, patients are like, well, I didn't get these benefits until I stopped doing hyperbaric. Hyperbaric was getting in my way of getting better, right? But not really. You're building the foundation. You're laying the foundation. You're creating all the important cell signaling cascades for all that time. And when you pull hyperbaric away, they just keep going. And so to really know when you're trying to plan protocols with patients, you start to figure out where they're starting to peak. And it's our interest to want to keep going, but even at that time, you pull it back and you just watch it continue to climb, and that helps you gauge that protocol. This was another stem cell. So this, again, different amounts of pressure, different amounts of oxygen, different periods of time create all of these different benefits. You understand? And it's hard to keep up with all the research, and one of the reasons we're doing the study we're doing right now is to try to answer some of these questions. But in that last one, it was like a 6 to 6.5 increase in stem cells. In this one, they were looking at mesenchymal stem cells and central nervous system stem cells. This was done at 2.2 atmospheres at 100% oxygen, and they saw an 8 times increase in both mesenchymal and central nervous system stem cell response post 60 sessions. This is what I was talking about earlier. I was saying the hypoxia, right? You go in the chamber, you get all the extra oxygen, you leave the chamber, it all comes out. They call that the hypoxia paradox. And what you'll see on the side of the picture, with hypoxia alone, you get HIF1 stimulation, you get VEGF, you get angiogenesis, you get stem cells, you get all of this anabolic response to hypoxia because the body's trying to deal with the low oxygen environment. But if you're chronically hypoxic, you start to lose sirtuin activity and you start to lose mitochondrial function because your oxygen levels are so low. Hyperbaric, you still get the HIF1, you still get the VEGF, you get BDNF, the platelet-derived growth factor, all the growth factors you can think of are stimulated through hyperbarics. But you also get an increase in sirtuins, not a decrease in sirtuin, and you get a massive increase in mitochondrial function, not a decrease. So, like I was saying earlier, you get all the benefits of hypoxia without the consequences of hypoxia, plus the benefits of hyperoxia as well. This was that study I was talking about earlier in terms of telomere length, and so in this study, they looked at telomere length and they looked at cellular senescence. They found up to a 20% increase in telomere length, which is literally tremendous given the fact that we've only tried to slow telomere attrition. There's very few things that we've ever found that actually lengthen telomeres. And so this was a 60-session treatment plan that they saw a 20% increase in telomere length. They also saw, depending on the cell type, they saw between a 10 and 30% decrease in cellular senescence, either through increasing apoptosis, killing those cells off so we can replace them with stem cells, or kicking them back into gear so they start becoming normal, normal functioning cells in that tissue bed. I have 8 seconds, so as much fun as that is. This was looking at testosterone. They